Hey my people, this is Dr. Shivam and today's session is going to be very important and it will be dealing with facial nerve. So facial nerve is something which is too important for your Neetpg and people find it very difficult to understand. So I will make sure that you get every MCQ right with this facial nerve. Whatever they are going to ask, you will get it in this video. So first of all, I will try to simplify the facial nerve for you because it is something which is a thing of interest for the ENT guys. So for simplifying the facial nerve, I will just draw a simple diagram which will look like this. So if you see, this is my facial nerve which is going, and then it took a turn which is called first genu, and then it took another turn which is called second genu. So this is all what you need to know about facial nerves. So it is that easy. So if you see, the facial nerve is a mixed nerve. That means it is having both the motor nucleus and the sensory nucleus. So the motor nucleus is located in the lower border of the pons, and while the facial nerve's motor branch moves in the brainstem, it encircles sixth nerve nuclei. So what is the significance of my telling that it is encircling the sixth nerve nuclei? So any lesion which is around the brainstem will involve the seventh nerve as well as sixth nerve. So what you will get, the patient will get ipsilateral facial nerve paralysis along with ipsilateral lateral rectus palsy. Why? Because you all remember LR6. So lateral rectus by nerve 6. So LR6. So along with the facial nerve palsy, you will also get sixth nerve palsy, and there arises a MCQ. So a MCQ is born from here. What is that MCQ? So that MCQ is Miller-Gubler syndrome. So Miller-Gubler syndrome is, along with these palsies of facial nerve and lateral rectus, there is contralateral hemiplegia, and that is called Miller-Gubler syndrome. So how beautiful and how simple it is to know about Miller-Gubler syndrome, which is a contralateral hemiplegia along with the ipsilateral facial nerve palsy and ipsilateral lateral rectus palsy. Now this was about some syndrome. Now we were discussing about facial nerve. So we will return to our facial nerve. Okay, so facial nerve as such, if we see, has three main parts. That is intracranial part, intertemporal part, and extratemporal part. And the good thing about intertemporal part is that it is further divided into four parts. So our intratemporal part is further divided into meatal part, that will be in the internal auditory canal, the nerve lying in the internal auditory canal, labyrinthine part, which is very important because it is the smallest and the thinnest, that is the narrowest part of the facial nerve. So most of the time, like in Bell's palsy and in other parts, the facial nerve is compressed in the labyrinthine part. So regarding MCQ, labyrinthine part is the most important part for you, measuring just 3 to 4 millimeter. So smallest and narrowest diameter is only 0.68. So I am trying to simplify you for it, so for you as much as possible. So meatal, labyrinthine, and then we have a vertical part, that is then we have a horizontal segment, that is the tympanic, which travels through the tympanic cavity, and then the vertical or the mastoid. So you can see the simple diagram here. This is the first genu, this is the second genu, this forms the vertical part, this forms the horizontal part, and this forms the vertical part, that is the mastoid part. So from here, from the motor nucleus of our facial nerve, our nerve arrived. It entered into the internal auditory canal, that is the intrameatal part. We will name it as 2. First was intracranial part, second is intrameatal part, and third is the intratemporal, that is the labyrinthine part. We'll name it as 3A. Our horizontal part, which is the 3B, and our vertical part, that is the mastoid part, which is 3C. And then after the stylomastoid foramen, it goes to the extratemporal, that is in the parotid, dividing into the 5 branches called pes anserinus. So we will discuss it separately. Now what is important here is, once you got a general idea about things, we will also see what branches are there of facial nerve. So the acute bends are called genu. So this is the first genu and this is the second genu. So once you know the branches, you will get to know why it is important to know about them, because we need to diagnose a patient with facial palsy, that at which level the facial palsy is occurring. So for that we need to see the branches. So once we are over with this, we'll see the branches of facial nerve. Now we'll again draw our facial nerve. So this was our facial nerve, and this was our first genu, second genu, our horizontal segment, our vertical segment. So at the first genu, that is this part, the facial nerve gives its first branch. So what is this first branch? This nerve is called GSPN, greater superficial petrosal nerve. It also gives 2 more branches, that are lesser petrosal nerve, LSPN, and the third nerve is ESPN. So 3 nerves. Although these 2 are relatively less important, this GSPN, what it does is, it supplies the lacrimal gland, nasal glands, and the minor salivary glands. So this GSPN, what it does is, it supplies the lacrimal, nasal, and the minor salivary glands. Then it gives a second branch from here, second branch of near the pyramid to the stapedius muscle. So it gives a branch, that is stapedius, nerve to stapedius near the pyramid. It gives a second branch near the pyramid and the second genu. Yeah, so this is the stapes, and it gives a second branch, that is nerve to stapedius, and then finally it gives a third branch before it exits through the stylomastoid foramen around 3 to 4 or 4 to 6 millimeter before the exit of facial nerve from the stylomastoid foramen. It gives another branch called chorda tympani. Now these nerves were important so as to localize the site of lesion of facial nerve. So once you know the level of these nerves, the first GSPN for this lacrimation was at first genu. The second nerve, that is the stapedial, nerve to stapedial, is at the second genu, that is at the pyramid, and the third is just before the exiting from the stylomastoid foramen. Now we can see what happens and how we can localize the lesion. So those tests are called topodiagnostic test. So now we will discuss an important topic called topodiagnostic test. So there are basically some important tests like shimmer test, stapedial reflex, and taste. Yes. So shimmer test just checks the function of GSPN, that is, it checks whether the both eyes have same amount of lacrimation by putting the Wortmann filter paper in the lower eyelids. So it is positive if there is less secretion from the eyelid, and it is negative if it is normal. Stapedial reflex is a normal phenomena which occurs due to loud noise in response to loud noise, but if it is negative, that means the nerve to stapedius is not working. And taste is by chorda tympani, which supplies to the anterior 2/3 of the tongue. So if you test the nerve, the tongue, for anterior 2/3 taste and you don't get the taste, that means this is something wrong with the chorda tympani. So any patient appearing to you in your OPD, you have to do this topodiagnostic test to test for the facial nerve. Okay. So now you can recognize, I will just imagine a patient with shimmer's test negative. That means the patient is having less lacrimation. That means lesion is somewhere above the first genu. A patient having stapedial reflex absent, that means the lesion is between the first genu and the second genu, that is before pyramid. And if the patient is not having the taste sensation but the stapedial reflex is present and the lacrimation is normal, that means the patient is having lesion somewhere here, that is before the stylomastoid foramen. So this topodiagnostic tests are very important to just to know the level of lesion for the facial nerve. So we'll again try to revise these things. Just see here and tell me. So if there is lesion here, what all you will find negative? I'll try to maximize it. Yes. So if there is lesion somewhere here, yeah, so somewhere here, if there is lesion here, all the thing, that is, the lacrimation will be absent due to this GSPN, the stapedial reflex will be absent, and the taste will be absent. But if there is lesion somewhere here, that is after the first genu and before the nerve of stapedius, that is second genu, the lacrimation will be normal, but stapedial reflex and the taste will be absent. And if there is lesion somewhere here, then lacrimation will be normal, that is shimmer's test will be positive, stapedial reflex will be positive, but chorda tympani, that is the taste, will not be there. So this test help in the identification or localization of site of lesion. Now there is something called the disorders of facial nerve, that is the Bell's palsy, Ramsay-Hunt syndrome. So those you will get in the MEDX app. Do download the MEDX app, because this year a lot of things, lot of important things will be there for you by a lot of good educators. And do subscribe for the course, which is means just a boon for you for your Neetpg examination, fixed at the minimum possible cost. So this is just an overall diagram of facial nerve summarizing for you. So this is the motor nucleus of facial nerve. As it is mixed nerve, it also has a sensory nucleus, that is nucleus of tractus solitarius and superior salivatory nucleus. So these two forms a nerve called nerve of Risberg, which travels with the motor branch of the facial nerve. So up till now we have all read everything about this motor nerve, and this nerve of Risberg also travels with the facial nerve along its course. And from here, from geniculate ganglion, the first genu, the GSPN is given off then the external and the lesser petrosal nerves are given off. Then the nerve of stapedius nerve to stapedius and the chorda tympani nerve. So this was the basic general about the facial nerve, and for more do download the Medix app. A lot is there in it. I hope this video helped you. Thank you. This is Dr. Shivam. Do like, subscribe, comment and how it is helping you.